This is Suzanne Connors-Zink from Dawning Visions Hypnosis, and today's subject for mental health providers is simply this. Do you have a number of patients leaving your practice without ever telling you why? This is a question that comes up with folks on Quora, not the practitioners so much as the patients, who are usually asking if it's okay to just leave and not go back to a mental health provider who they found to be incompetent in one way or another, who they didn't feel comfortable with, or maybe felt that the provider said stuff that they didn't agree with and didn't want to continue seeing for that particular reason. And this is something that needs to be dealt with in reality, and I'm not really sure if you all understand why these particular patients do what they do. My answers to them, by the way, is to always go back, at least for one last termination session, and I explain what that is, to explain what happened so that the provider can have a chance to explain what they were doing, apologize if the patient was hurt in some way or another, because everyone has feelings and they're allowed to have their feelings and these need to be respected, and to see if it could be worked out instead of leaving that provider's care. But I can tell you from the folks who leave your practices and come to my practice that the reason patients do this is because many times practitioners will tell them what they're thinking and feeling, which obviously you have no way of knowing. None of us do, because we can't get into our patients' or clients' heads. Nor do we necessarily want to in a lot of cases. They do have a lot of problems. However, that being said, it is something that we need to be really careful of. And one of the things that I learned in my training in neuro-linguistic programming in particular was to always frame the question in terms of something like, I don't know if I got this correctly, but what I think you're saying is XYZ. Is that right? And to just have curiosity about what they said so that you can actually get on the same page without making your patient feel dehumanized or demeaned by you thinking, well, maybe you or maybe not you, depending on if you do this, that you know more than they do about what's going on in their own minds. And even as a hypnotist, I am unable to read minds, and I tell my clients, before they're even clients, when we have the free consultation call, so I can make sure that they fit in my scope of care, make sure I actually like them enough to spend multiple hours working with them, because I spend 2 to 3 hours in a session to get them to the point where I need them to be when we're clearing out all their traumas. It's like the first 2 to 3 sessions. To know that they are invested both emotionally and financially in getting the care that they require, and that they feel that they can work with me. If one of those things isn't aligned, it's a no-go, pure and simple. So we have to make sure that we have the right person to be working with. Now, I understand that if you're working in an agency, you're basically assigned patients to work with, and you need to make the best of it, and that's not an easy situation, which is why it's probably better for you to figure out a different way to earn your living if you're sick of dealing with uninterested, uninvested patients who maybe make your life a little bit more difficult, or maybe a lot more difficult than you would like it to be. And I can tell you that being able to discern who is a good fit for your profession, the type of people that you really love working with, and the personality match is really the thing that makes a difference in helping people heal versus having arguments with them every session, or having them stare out into space and not be comfortable talking to you about anything, which is another thing that comes up in the core questions a lot, in terms of, why is it that if I have nothing to say, my therapist is not willing to give me things to talk about? Or why do they let me stare out into space for the entire session? It's a waste of time. Things of this nature. So if they do not tell you what is going on, it's up to you to ask the question so that you can help them open up in a way that feels safe for them. Now, I tell you all this because there are too many mental health providers out there who are leaving the profession. And they're leaving the profession for many reasons. This may be one of them. So if you fall under that category, I want you to really think about how you may be interacting with your patients in a way that they are finding disconcerting, hurtful, unnecessary, and the opposite of feeling like they're being helped. Because no one's going to leave a mental health provider who's giving really good support and is present and able to truly help them. Nobody. So these are questions that you need to ask yourself. So I have a 2-day VIP training that I do to help mental health professionals to be able to integrate hypnotism and neuro-linguistic programming into their professional toolboxes so they can actually access the subconscious, unconscious mind of their patients. So instead of managing symptoms and seeing them forever in sessions, you can actually help them heal the cause of the problem. That would be the event that caused it to develop in the first place, and to figure out the purpose of why they're holding on to the dysfunctional thoughts and behaviors, because if they didn't have them, they wouldn't be needing to see you, and to help them to find their compelling future, which should be the reason that they would be willing to do the work in the first place in order to truly heal and move on with their lives. Because everybody deserves to live a life without having to have mental health diagnoses and, worst of all, symptoms. They have a right to move on with their lives. However, in order to help them do that, you need the right tools and techniques to make that happen. And I'm here to tell you that in 20 plus years of hypnotism, I would say probably 85% of my clientele were able to totally heal. And they have been healed for as long as 2003 to now. I have eating disorder clients. I have sex addicts who've been healed since 2005. I'm in communication with some of them, even at this late date. And that's a really good thing. And that would be something I would think that all of you would want to know how to do if you actually got into the profession to help people heal and to actually make a really good income doing that. Because if you're able to help people heal, they'll pay anything to make that happen. But you have to know that you're able to do that with people who have done it through your treatment process. So the information for that will be, well, my contact information will be down below so that you can connect with me and we can set up a time to have a consultation regarding that particular program. It's a 2-day VIP program. It's all online. It's one-on-one. And I have a 12-month mentorship that goes along with that so that you can actually learn how to organize, how to go about doing the different techniques, and if you need help in how to do them as the patients show up in your practice, I can go through that with you as well. It's really the way that I learned how to learn it, to do this stuff and be really proficient with it. And so I believe that everyone deserves to have a mentorship when you're learning how to do hands-on techniques. And it's not something that I see offered by any of the other trainers of hypnotism or NLP these days. I was lucky to have that offered to me when I was going through my training back in 2003, 2004 most especially. So I offer that. It is the difference that made the difference in my life, and I believe it would be the same for you. So that's all I have for you for today. Thank you for spending your time with me. Till next time. Bye-bye all.